At the DDU, we fully appreciate the stresses and additional pressures returning to practice in the current coronavirus pandemic is causing our members. Trying to keep up to date with all the guidance is hugely time consuming, and it is understandable that whilst the focus is on adapting to new ways of practicing dentistry, things such as complaint handling may have fallen down the priority list. My name is Suna Jai, one of the DDU's team of 14 dentally qualified advisors, and in this short video, I'm going to speak to you about the importance of having good complaint handling policies and procedures in place in the current climate. The avenues for complaints remain the same, and so it is important to keep the administrative side of the practice running as usual and respond to any complaint correspondence promptly, seeking advice from the DDU as soon as possible. For NHS patients, the first stage of the complaints procedure is at a practice level or via the relevant NHS body, with the second stage for any unresolved matters being the relevant health service ombudsman. Private patients can also complain to the practice directly or raise their concerns via Dental Complaints Service. The GDC fitness to practice investigations are still ongoing during the pandemic, with some urgent hearings being held remotely. Legal claims can still be brought, with solicitors' firms open for business as usual. Complaints should still be handled in line with your practice protocols, conforming to current NHS guidance and GDC standards, and it is increasingly important to send prompt acknowledgements and manage patient expectations as to the possible extended response times. You will, I am sure, have experienced trying to contact a service provider or company during the pandemic and have been advised of the longer response times. We recommend you do the same for your patients via website or phone systems so that you can then amend your acknowledgement letter accordingly. Whilst most patients will be understanding about the unavoidable delays, others may be less so, and it is important to have a clear audit trail of your communications during this difficult time. Good recording and tracking of the complaint progress is key to avoid any unnecessary criticism by the patient or any third party looking into the complaint handling. The types of complaints we can expect to see during the current COVID pandemic are likely to arise due to increasing frustration on the part of the patients who may be in pain, overly anxious, and very frustrated by the lack of immediate access to full dental services. For example, any perceived shortcomings in the attitude of staff who are dealing with triage and frontline calls, trying their very best to prioritise and schedule appointments, their interactions with patients will come into sharp focus. Some patients might be frustrated by the reduction in the availability of the appointments and a reduction in the types of treatments available. Patient expectations will need to be carefully managed, so good communication prior to patient attendance is very important. Clear training and guidance for frontline staff is advisable to maintain a consistency of approach. We expect that patients caught mid-treatment at the start of lockdown may have particular concerns and anxiety about any detrimental effect the delays might have had for their oral health. Careful reassurances and clear explanations with options should be given. Failed restorations may result in the only option being an extraction. Patients might not fully appreciate that this deterioration in their dentition and lack of available options are not of your making. The limitation of treatment options during the pandemic and how any onward referrals are managed may also give rise to complaints. Although much of this is outside of your control, the way these issues are communicated to the patient could help reduce confusion and complaints. Please help us to help you by having as much documentary evidence of all the discussions you have had with your patients and your justification for the treatments you are undertaking at that particular time, mapped to the relevant guidance and in accordance with your standard operating procedure. There is a general concern within the profession as to how the increased running costs can be met to maintain the viability of the practice. Within the private sector, this cost may well be passed on in full or in part to the patient. While some patients will understand and pay willingly as they value the service provided, others might be less sympathetic to this increase in dental fees, this giving rise to complaints. So, in summary, the same principles of patient management apply in the current climate with a focus on good, clear communication alongside detailed record keeping, mapping all decisions to current guidance and documenting patient's consent. Continue to act promptly when responding to any complaint, carefully managing patient expectations as to response times, and keep the lines of communication well and truly open. Now, more than ever, the smooth running of the practice relies on excellent teamwork, working closely together to support our patients and our colleagues at a very difficult and uncertain time. We recommend you continue to encourage all patient feedback as you are developing your new surgery systems and protocols, learning from the feedback to help provide a safe and welcoming environment where patients feel at ease and well looked after. As always, please do contact us early for advice, support, and guidance. Our dental legal team are available 8 till 6, Monday to Friday, and we provide an on-call service for dento-legal emergencies or urgent queries 24 hours a day, 365 days a year. Thank you for listening.